So I'd like to take a look at my case here. This is a 60-year-old patient when she was diagnosed with glaucoma in 2008. So we have about 16 years of follow-up. And while this is not so much a diagnosis case, it's a little bit more of a management and progression case, it really speaks to the structural biomarkers that we use regularly in our patients with glaucoma to identify this change over time. This patient had a positive family history of glaucoma, had high eye pressure at diagnosis, is currently being treated with travoprost and a combination of brimonidine and timolol. She's had 2 SLTs on each eye and currently has been showing some fluctuation in the eye pressure. And so, of course, the concern from us from a clinical standpoint is, is this patient progressing? Can I identify that accurately and confidently with the structural biomarkers that we look at in glaucoma? And does that guide my management for this patient? So let's take a look at some of the clinical data for this patient. Here we have the IOP and central corneal thickness data. You can see that the pre-treatment IOP was 27 in the right eye and left eye, and the corneal thickness back in 2005 when it was first measured was 538 and 535. And then I've included a graph here of the IOP measurements from 2011 through 2018. And you can see some of the variability of the eye pressure in that time period. So this is just sort of the first part of the case that I want to show you the data. And then we're going to go to the time period after 2018 and show you a little bit more data and how our OCT and the biomarkers that we were looking at helped us identify what we needed to do with this patient. In this layout here, you're taking a look at photos of the right eye from 2010 to 2018. So again, that's one way we structurally look at our patients with glaucoma. We can take 2 sets of photos and look at them. I've laid out 2 visual fields, one from 2010 and one from 2018 for the right eye, circled in blue there, where there's really not too much change in the superior hemifield for the patient's visual field defect. And then on the bottom, I have the optic nerve head and retinal nerve fiber layer reports to show the OCT analysis for the right eye and the left eye in this style report. And as you can see there, as you look into the circles where I've highlighted the average RNFL thickness, and then down below for the RNFL quadrants, the inferior quadrant for the right eye, most all of the metrics in there for the RNFL is staying pretty much the same. So not much change going on there, at least in this way of looking at the structural data over time. However, in the red circles is the data for the left eye, and you can see that there is a significant drop-off in average RNFL thickness and for the inferior RNFL quadrant from 65 down to like 49 microns of thickness. And then similarly, I have information here for the left eye, again, photographs 8 years apart. Can you really see a difference there? I don't think there's really much of any change there. You would look at the visual field. Again, there's more cupping and damage and thinning to the neuroretinal rim inferiorly in this patient in both eyes, and thus most of the field loss is superiorly, as you can see on the Humphrey visual fields there. And then on this slide here, I've included the ganglion cell analysis reports. Again, not showing too much change for either eye in this slide set. But more typically, I think when we're following our OCT biomarkers for RNFL and ganglion cell, we're looking at our progression reports. And so to identify a patient who is changing from normal to developing glaucoma, or a patient with glaucoma who's already diagnosed and we're worried about progression, we're using this type of layout for a GPA or guided progression analysis report. And for the right eye on the report through 2018, and then for the left eye on the right side, the similar report there, you see not really too much change there for the right eye, but as you look into the red circles on the report for the left eye, you see a significant loss in RNFL thickness, average RNFL thickness for the left eye. And you can also see that if you look to the superior RNFL thickness plot, where you get a rate of change of minus 1.81 microns per year, which is not terribly high, but over time, that certainly can add up to significant loss for our patient. Let's also take a look at progression reports for the ganglion cell analysis. And again, on this report here, through 2018 for the patient, not too much of any change. Here is the GPA reports from the Humphrey Field Analyzer. Again, while we're focusing today mostly on the structural biomarkers for glaucoma, we do have to match this up with our functional reports, and using GPA reports for our field analyzers is really super critical. And you can see really not much of any change for the right eye over a long period of time, from even going back to 2006, where I found an old test, to 2018. And then for the left eye, maybe there's some increased change superiorly, but really not too much at this point in time. So now let's focus on the last 6 years or so. And as you can see in the right-hand side of the IOP graph there is a change in the IOP fluctuation with an IOP spike. A second SLT was performed on each eye. And then even into 2022 and 2023, there's still some volatility and fluctuations in the patient's IOP. And so that was concerning to us. We continued to look at photographs going back to 2010 and now comparing them to our photographs from 2022. Sorry about the blurriness there. It's a little bit out of focus. But again, questionable as to whether or not there's any real change that we can detect on our photographs here for this patient. But if we switch over to our GPA reports for the retinal nerve fiber layer, one of our key biomarkers, we can see that from 2020, which is the report on the left side, to 2023, the report on the right side of the slide, you can see that there is a superior retinal nerve fiber layer area that is decreasing in thickness that is identified on the deviation map in my red arrows there. And that's becoming becoming flagged by the summary report at the bottom, and then also identified by a more significant rate of change for the superior RNFL thickness of minus 1.97 microns. And then in 2024, this becomes even more obvious. So again, the retinal nerve fiber layer here has been identified as a structural biomarker for key change for our patient over time. I've now included some more recent visual fields where, yeah, for sure, going back to 2010, there's been progression to the visual field. And sometimes you have to sort out whether or not that changes from early on in the disease process and whether or not that's stabilized now to whether or not it's just continuing to change at this point in time. You can do other things on your visual field report, like doing a dual baseline report to get that rate of change. And here's a report for the ganglion cell analysis biomarker that also, again, tells us that this patient is progressing at this point in time. So in summary for this case, this is OCT structural progression using the RNFL and ganglion cell interplexiform layer. The patient is on 3 medications, and we have some options that we need to have some careful consideration for. We probably have a much lower target pressure now in the 10 to 12 range. We might get there with additional medication, a surgical procedure like canaloplasty, although unfortunately other MIGS procedures are not available because there is no cataract present in the patient, or she might even need more aggressive trabeculectomy or tube shunt procedure. And you might finally decide just to monitor the biomarkers more closely as you evaluate how fast this patient is really changing and what the best intervention is. And of course, discussion with the patient and your surgeon is really the best guidelines there. So in summary, structural biomarkers are key for diagnosing glaucoma and following patients over time. The retinal nerve fiber layer is our lead indicator. We use a lot, though, for the ganglion cell and interplexiform layer, where the change tends to start later and last longer. We look at rate of progression, and of course, we're always doing some functional assessment with our visual field device.